If you've been told surgery is the only way to heal your rotator cuff tear, you might not have the full story. And while surgery is necessary for some cases, the reality is that most rotator cuff tears can get by without it, but only if you take the right steps to support your recovery. Hey everyone, Dr. Jeff Peng here. As a sports medicine doctor, I've helped countless patients recover from their rotator cuff injuries naturally, avoiding the risks, challenges, and long downtime associated with surgery. If you're struggling with pain, weakness, or limited range of motion, today I'm going to share science-backed strategies to help you overcome your shoulder problems. Here's a list of all the things we'll cover. First, I'll break down the anatomy of the rotator cuff and explain what's really happening with these injuries. We'll talk about why delaying treatment can lead to worse outcomes, but also why surgery isn't always the answer. Then, I'll guide you through proven recovery techniques, including a sample rotator cuff exercise program, pain relief strategies, and advanced treatments like platelet-rich plasma injections. Finally, I'll share a real-life success story of a patient who avoided surgery and made a full recovery, complete with ultrasound images showing the torn rotator cuff tendon actually healing. So let's start this discussion by introducing the rotator cuff anatomy and function. The rotator cuff is a group of 4 muscles and their tendons that surround the shoulder joint. They provide stability and enable us to move our shoulders with a wide range of motion. These muscles work together to lift and rotate your arm, making them critical for everyday activities like reaching, throwing, lifting objects, or playing sports. When a rotator cuff tendon tear occurs, it can range from a small partial tear, where only part of the tendon is damaged, to a full thickness tear, which extends through the entirety of the tendon. These tears can also be classified based on their cause and progression. Acute tears are typically the result of trauma, such as a fall or an injury when playing sports. Degenerative tears develop gradually over time due to repetitive stress, aging, or poor shoulder mechanics. Small partial tears rarely require surgery and are often discovered incidentally during imaging for unrelated issues. In fact, many rotator cuff tears can be considered part of the normal aging process. Many people with small tears experience little to no symptoms and can maintain normal function with proper management. These claims are supported by imaging studies looking at the prevalence of rotator cuff tears in asymptomatic populations. In other words, the studies ask the question, how many people with no shoulder pain have rotator cuff tears and are going about their daily lives completely unaware of these tears? The findings reveal that rotator cuff tears are surprisingly common, affecting up to 34% of people across all age groups. Among individuals aged 60 and older, the prevalence increases significantly to 54%. Even more striking is that over half of these older adults with rotator cuff tears had full thickness tears, yet despite the severity of the injury, these individuals remained entirely pain-free and asymptomatic. So what these studies tell us is that rotator cuff tears are relatively common in the general population. And so just because you have a rotator cuff tear, even a full thickness tear, does not mean you have to have surgery to correct it. What we actually need to do is correlate imaging findings with the patient's symptoms, activity levels, goals, and overall function. Treatment should focus on the individual, not just the imaging results. Context really matters. Gone are the days of simply treating the picture seen on the MRI. Okay, so with all that said, the extent and nature of the tear often predicts the need for surgery. Traumatic tears, or tears that have significant retraction, particularly in younger or more active individuals, are more likely to benefit from surgical intervention. This is because these injuries often involve significant disruption to the tendon and a higher risk of persistent weakness or loss of function. On the other hand, degenerative tears, commonly seen in older adults, rarely require surgery. These tears often respond extremely well to non-operative management, including physical therapy and targeted rehabilitation exercises. These treatments can significantly improve function and decrease pain without the risks and downtime associated with surgery. So if you have a rotator cuff tear, How do you know if your symptoms are severe enough to warrant surgery? This is an important question to ask because symptoms can vary widely, and what bothers one person may not really affect another. Symptoms can range from mild discomfort to significant pain, weakness, and restricted range of motion. You might also notice some clicking or popping sounds when you move your shoulder, particularly during everyday activities like reaching overhead or lifting objects. The more severe these symptoms and the more they interfere with your quality of life, like work or even sleep, the more aggressive your treatment approach may need to be. The reason for this is because more severe symptoms typically predict more serious complications. For example, significant shoulder pain can lead to prolonged disuse. This increases the likelihood of developing a frozen shoulder, a condition that can take 1 to 2 years to fully recover from. Another major concern is muscle atrophy. This is where the surrounding muscles weaken and shrink due to inactivity. This then makes everyday tasks like putting dishes back in the cabinet or even just combing your hair much more difficult. Additionally, untreated rotator cuff tears can result in structural changes within the joint over time. This can contribute to the onset of shoulder osteoarthritis. With all that said, severe symptoms don't necessarily mean you need to jump straight to surgery. Instead, they highlight the need for more aggressive management of your shoulder. This often involves a combination of targeted exercises, physical therapy, or anti-inflammatory medications. For more advanced cases, treatments like injections may be recommended. However, for those who continue to experience persistent pain despite aggressive non-surgical management, surgery may be a good option. This non-surgical approach as the first line of treatment is well supported by clinical trial data. One study compared immediate surgical repair with delayed surgery after a 6-month trial of non-surgical treatment for partial thickness rotator cuff tears. The results showed that both approaches significantly improved pain and function, with a very low rate of re-tears in either group. Interestingly, patients who delayed surgery and first tried non-surgical care reported better pain and functional outcomes 6 months after their surgery compared to those who opted for immediate repair. Additionally, some patients in the delayed surgery group experienced such significant symptom improvement during their non-surgical treatment that they decided surgery wasn't necessary at all. This supports the idea that a trial of non-surgical management can be a reasonable and effective first step for partial tears. Now, what about full thickness tears? Another study found that both surgical repair and non-surgical treatment resulted in reduced pain and improved function. However, patients who underwent surgical repair reported significantly greater improvements in outcome scores and pain levels compared to those treated non-surgically. The benefits of surgery were particularly pronounced in younger patients, those with shorter symptom durations, and those with more demanding activity levels. This highlights that while non-surgical treatment can still provide relief, surgical repair may be more beneficial for certain individuals. Finally, a large randomized controlled trial examining treatments for rotator cuff disease, including partial tears, confirmed that both surgical and non-surgical approaches improved pain and function over a 2-year period. The difference between the groups for partial tears was minimal, suggesting that non-surgical care should generally be the first line of treatment. However, for patients with full thickness tears, surgery demonstrated superior outcomes in pain reduction and functional improvement. The study's authors recommend surgery only after non-surgical treatments have been tried and failed, reinforcing the importance of starting with less invasive options. The takeaway is that many rotator cuff tears, particularly partial or degenerative tears, can be effectively managed without surgery, making non-surgical care the best place to start. With options like physical therapy, pain management strategies, and advanced treatments like PRP, you may see significant improvements without the risks or downtime associated with surgery. However, for full thickness tears, particularly in younger or more active individuals, surgery may provide better outcomes, especially if symptoms persist despite non-surgical care. Okay, now let's transition to talking about the key components of non-surgical management. The first step is to protect the injured tendon and prevent further damage. This means avoiding activities that aggravate the injury, such as heavy lifting, overhead movements, or repetitive motions that strain the shoulder. However, resting the shoulder does not mean complete immobilization. It's about finding the right balance between protection and movement to support healing. In some cases, using a sling or brace may be helpful to temporarily offload the shoulder, especially in the early stages of recovery or after a flare-up of symptoms. Keep in mind that these should be used judiciously and not more than just a few days. Over-reliance on a sling can lead to stiffness and muscle weakening, which may hinder progress in the long run. Using a sling for too long also increases your risk of developing a frozen shoulder. Making small adjustments to your daily activities can significantly reduce strain on your shoulder. For example, use both hands to lift heavier objects. Keep frequently used items at waist level to avoid repetitive reaching. And take breaks during tasks that require prolonged arm use, such as typing or cooking. Ergonomic changes in your workspace, like adjusting your desk and chair height, can also minimize stress on the shoulder joint. Pain during sleep is a common complaint for rotator cuff injuries, but simple changes can make a big difference. If you sleep on your side, avoid lying on the injured shoulder. Instead, use a pillow to support the affected arm and maintain a neutral position. Sleeping on your back with a small pillow under the injured arm can also reduce strain and help you rest more comfortably. As soon as pain comfortably allows, we want to start physical and exercise therapy. Contrary to popular belief, complete immobilization is rarely the right approach for rotator cuff injuries. Movement is critical for preventing stiffness, maintaining range of motion, and promoting circulation to the injured area. Controlled, pain-free motion encourages the tendon to heal properly and helps avoid complications like a frozen shoulder. Now, I understand that many people are going to be cautious about moving an injured shoulder, especially if you've experienced sharp pain in the past. However, this fear of movement can create a cycle of avoidance that leads to muscle weakening, joint stiffness, and more pain. A well-designed physical therapy program can help you break this cycle by gradually reintroducing movement in a controlled and safe way. Now, the next thing I want to talk about are advanced non-surgical therapies to treat rotator cuff tears. These include injection treatments such as corticosteroid injections as well as platelet-rich plasma injections. Recent studies suggest combining regenerative medicine techniques like PRP with exercise therapy can significantly accelerate recovery. However, understanding the benefits and limitations of each treatment is critical for making informed decisions. Let's first address cortisone injections, also known as corticosteroid injections. These are a common treatment option for rotator cuff injuries, but are primarily used to reduce pain and inflammation. These injections can be incredibly helpful in the short term, especially if pain is severe and interfering with sleep or daily activities. By calming the inflammation around the shoulder, corticosteroid injections can provide temporary relief and make it easier to participate in physical therapy. However, it's important to understand that corticosteroids are not a cure. While they can reduce inflammation and alleviate pain, they do not promote healing of a torn tendon. In fact, repeated cortisone injections carry significant risks. Over time, they can weaken the tendon structure, increasing the risk of further tearing or worsening the injury. Additionally, multiple corticosteroid injections can complicate surgical repair by further compromising tendon integrity. For these reasons, corticosteroid injections should be used sparingly and reserved as a short-term tool for managing acute symptoms. Platelet-rich plasma injections are a specialized treatment within the field of regenerative medicine and orthobiologics. PRP has been gaining attention as a promising option for treating rotator cuff injuries, particularly small tears and even high-grade partial tears. PRP is derived from your own blood and involves concentrating platelets as well as obtaining growth factors that promote tissue repair and healing. When injected into the site of the tear, PRP can accelerate the body's natural healing processes by stimulating collagen production and reducing inflammation. If you're interested in learning more about PRP, I've made an entire deep dive video explaining it, so check it out here if you're interested. Recent evidence supporting PRP for the treatment of rotator cuff tears is fairly compelling. One study compared PRP to a placebo in patients with high-grade partial rotator cuff tears. At 6 months of follow-up, nearly 80% of people who received PRP showed complete healing of their tears. This is compared to 30% of patients in the placebo group. This suggests that PRP is not only effective at managing pain, but also has the potential to directly heal the damaged tissue. Other studies have directly compared PRP injections to corticosteroid injections and found that a single PRP injection in patients with rotator cuff tendon disorders showed significantly superior and sustained pain-relieving and functional improvements compared to corticosteroid injection at 1 year of follow-up. The overall failure rate was also significantly higher in the corticosteroid group than in the PRP group. So unlike corticosteroid injections, PRP addresses the underlying injury. It actually induces healing of the tendon, which is why long-term studies show that its effects are sustained. So even though PRP is an out-of-pocket expense, its ability to heal the tendon and improve function makes it a valuable option for many patients. Okay, now that you have a better understanding of rotator cuff injuries and treatment options, let's dive into a sample rotator cuff rehab program. What I'm about to show you is the same exact rehab program I've used with my patients, and I've seen excellent results, fast resolution of pain, and significant improvements in function. This program is designed to gradually strengthen the rotator cuff muscles and improve shoulder mobility without causing further injury. It's been a game changer for many of my patients who want to recover without jumping straight into surgery. The program should be done 3 times per week, about every other day for at least 6 to 8 weeks. After that, I recommend doing the exercises once or twice a week for maintenance and to help prevent future rotator cuff issues. And as always, be sure to consult your healthcare provider before starting to ensure this program is right for you. Okay, so let's start with an active shoulder warm-up. This will help increase blood flow, loosen up the shoulder muscles, and prepare your shoulder for the rehab exercises. The first exercise is arm swings. Begin by swinging your arms forward and backward, crossing them in front of your body as you swing them forward, and then opening them wide as you swing them back while squeezing your shoulder blades together. Continue alternating between crossing your arms in front and opening them wide. Do this 10 times. Next, we're going to do shoulder rolls forward. Keep your arms relaxed at your sides and lift your shoulders up and toward your ears. Gently roll them forward in a circular motion, then continue the motion as you bring your shoulders back down and return to the starting position. Repeat this 10 times. Now we're going to do shoulder rolls backwards. Same thing, but now lift your shoulders up towards your ears, then gently roll them backward in a circular motion. Continue the motion as you return to the starting position, and then repeat this 10 times as well. The final part of the warm-up is scapular squeezes. Start with your arms at your sides, then pull your shoulder blades back as if you're trying to make them touch. Squeeze them together for 1 to 2 seconds at the peak of the movement, then return to the starting position. Repeat this 10 times. This squeeze motion activates key muscles like the rhomboids and middle traps, which are essential for maintaining proper shoulder alignment and preventing compensation during shoulder movements. Now we're going to move on into some strength training exercises, but before we get started, if you're dealing with significant shoulder pain, it's important to start with fewer repetitions or lighter weights. The goal is to gradually increase the weight as your shoulder pain decreases and strength improves. This approach ensures you're challenging your muscles without overloading the injured area. The first exercise is called scaption. Stand with your feet shoulder width apart and hold a dumbbell or resistance band. Slowly lift the weight in front of your body at a 30 to 45 degree angle, raising it until your arm reaches shoulder level. Pause briefly at the top, then gradually lower it back to the starting position. Do 3 sets of 10 repetitions. This exercise targets and strengthens the supraspinatus and deltoid muscles. The supraspinatus is vital for stabilizing the shoulder and initiating arm movement, especially when lifting the arm away from the body. Strengthening this muscle improves shoulder stability, reduces pain, and helps prevent further injury, particularly during activities that involve overhead or lifting motions. The next exercise is a shoulder lateral raise. Stand with your feet shoulder width apart and hold a dumbbell or resistance band. Slowly lift the weights out to your sides, raising them until your arms reach shoulder level. Pause briefly at the top, then gradually lower them back to the starting position. Perform 3 sets of 10 repetitions. The shoulder lateral raise is an important exercise for rotator cuff rehab because it specifically targets the deltoid muscles, particularly the middle portion. Strengthening the deltoid helps improve shoulder stability and mobility, which is crucial for performing everyday tasks and preventing compensatory movements that could strain the rotator cuff. Now we're going to move on to a lying shoulder external rotation. Lie down on your unaffected side and bend your elbow to 90 degrees, keeping the elbow pressed to your side. Raise the dumbbell or resistance band by rotating your shoulder outward. Pause briefly at the top, then gradually lower it back to the starting position. Perform 3 sets of 10 repetitions. This exercise is crucial for rotator cuff rehab because it specifically targets the infraspinatus and teres minor muscles. These are responsible for external rotation of the shoulder. These muscles are key components of the rotator cuff and help stabilize the shoulder joint, particularly during movements that involve reaching or lifting. Strengthening these muscles helps improve shoulder control, reduces the risk of impingement, and supports proper shoulder mechanics. Next, we'll do a lying internal rotation exercise. Lie down on your affected side this time. Bend your elbow to 90 degrees and keep it close to your body. Raise the dumbbell or resistance band by rotating your shoulder inward. Pause briefly at the top of the movement, then gradually lower it back to the starting position. Perform 3 sets of 10 repetitions. This exercise is important for rotator cuff rehab because it specifically targets the subscapularis muscle. This is an important internal rotator of the shoulder. The subscapularis plays a critical role in stabilizing the shoulder and keeping the humeral head, which is the ball of the shoulder joint, centered in the socket. Strengthening this muscle helps improve shoulder stability and function, allowing for better control during everyday movements like lifting, reaching, and rotating. Now we're going to transition into dumbbell rows. Hinge at the hips with a flat back and knees slightly bent. Pull the dumbbells or resistance bands towards your rib cage by retracting your shoulder blades and bending your elbows. Hold briefly at the top of the movement, then slowly lower the weights back to the starting position. Perform 3 sets of 10 repetitions. Dumbbell rows are important for rotator cuff rehab because they target the muscles of the upper back, particularly the rhomboids and middle trapezius, which plays a crucial role in stabilizing the shoulder blade. A stable scapula is essential for proper shoulder function and injury prevention, as it helps the rotator cuff muscles work effectively. The last strengthening exercise we're going to do is the bent over reverse fly. Stand with your feet shoulder width apart, slightly bend your knees, and hinge at the hips so your back is straight and almost parallel to the floor. Raise your arms straight out to the side until they're in line with your shoulders. Hold briefly at the top of the movement, then gradually lower them back to the starting position. Perform 3 sets of 10 repetitions. The bent over reverse fly is crucial for rotator cuff rehab because it targets the posterior deltoid and the muscles of the upper back, including the rhomboids and trapezius. These muscles are important for maintaining proper posture and scapular stability, which are essential for rotator cuff function. Strengthening the posterior shoulder helps counterbalance the often stronger anterior shoulder muscles, and this helps promote better shoulder mechanics and reduces the risk of impingement. Now we're going to transition into some shoulder stretches. These can be done daily to help improve the mobility of the shoulder. We'll first start with an anterior shoulder stretch. Clasp your hands behind your back and lift them backward and upwards, pulling your shoulders back to deepen the stretch. Hold this position for 30 seconds. This stretch is important for rotator cuff rehab because it targets the anterior or front muscles of the shoulder, including the pectoralis major and minor. These muscles can become tight from poor posture, repetitive movements, or shoulder injury, and this can limit shoulder mobility and contribute to discomfort or impingement. Next, we're going to do an external rotation shoulder stretch. Stand at a doorway or use the edge of a desk or countertop. Place the inside of your forearm against the hard surface, then gently lean your body away until you feel a stretch in your shoulder. Hold this position for 30 seconds. This stretch is important for rotator cuff rehab because it targets the external rotators of the shoulder, including the infraspinatus and teres minor muscles. Over time, these muscles can become tight or restricted, particularly in individuals with rotator cuff injuries. By stretching them, you help improve shoulder mobility and restore balance to the shoulder joint. The next stretch is a posterior shoulder stretch. Bring your arm across your chest and bend your elbow. Use your other hand to press the arm closer to your chest. You should feel a stretch towards the back of the shoulder. Hold this stretch for 30 seconds. This stretch is important for rotator cuff rehab because it targets the posterior capsule and the muscles in the back of the shoulder. These muscles are key external rotators of the shoulder, and they play an important role in stabilizing the shoulder joint. Tightness or restrictions in the posterior shoulder muscles can limit range of motion, particularly during overhead or reaching motions, and this can contribute to shoulder pain. Now let's do an inferior shoulder stretch. Lift your arm overhead and bend it at the elbow. Use your other hand to press downward, and you should feel a stretch at the bottom of your shoulder. Hold this position for 30 seconds. This stretch is really important because it targets the lower portion of the shoulder capsule, which can become tight or restricted, especially after injury. The rotator cuff muscles, along with the capsule, help stabilize the shoulder joint during arm movements. Tightness in the inferior shoulder capsule can limit overhead motion and contribute to shoulder impingement or pain, especially during activities like lifting or reaching. The last stretch is an internal rotation shoulder stretch. Hold a towel, belt, or any object in one hand behind your back. Grab onto it with the hand of your affected shoulder and gently pull upwards with the top hand. This in turn is going to lift the bottom hand higher up your back. You should feel a stretch in the lower front of your shoulder. Hold this position for 30 seconds. This stretch is important for rotator cuff rehab because it targets the internal rotators of the shoulder, particularly the subscapularis muscle, which is a key component of the rotator cuff. The subscapularis helps with internal rotation and is crucial for shoulder stability. After a rotator cuff injury, this muscle can become tight, restricting internal rotation and leading to shoulder discomfort or limited movement. Stretching the internal rotators helps improve flexibility, restore full range of motion, and reduce tightness in the front of the shoulder. Remember, the goal of this rotator cuff rehabilitation program is not to build muscle for bodybuilding, but to gradually retrain your shoulder and strengthen the rotator cuff in order to decrease pain and improve function. Start with light weights and gradually increase as tolerated, progressively overloading the muscles to help your shoulder get stronger. As your shoulder improves, you can slowly increase the weights over time. Perform this program every other day, about 3 times a week for 6 to 8 weeks. Once your shoulder feels better, consider reducing the frequency to once or twice a week for maintenance therapy to help prevent future rotator cuff issues. The last thing I want to do is to share with you the story of one of my patients who had excellent success with his rotator cuff tear. Tony was 48, and he came to my clinic with persistent shoulder pain. He was fairly active and enjoyed playing recreational sports, going to the gym, and most importantly, spending time with his kids. Over the past several months, however, he began noticing a dull ache in his shoulder that progressively got worse. He couldn't pinpoint a specific injury, just seemed to develop gradually. At first, he tried to push through the discomfort, but the pain started interfering with his daily life. He took a month off from exercise, but when he returned to his usual activity, all the pain came back, and this time it got worse. Simple tasks like reaching for items on a shelf or putting on a jacket became difficult, and it even affected his sleep. He told me that the worst part was no longer being able to play with his kids without wincing in pain. When I saw Tony in my clinic, his symptoms were consistent with a rotator cuff issue. He described classic signs: pain with overhead movements, weakness when lifting objects, and occasional clicking or popping in the shoulder. He also noticed that lying on the affected side made it nearly impossible to get a good night's sleep. On physical exam, provocative tests reproduced his symptoms, further confirming that his rotator cuff was likely the source of his problem. To get a definitive diagnosis, I performed a diagnostic ultrasound evaluation of his shoulder. The imaging revealed a partial tear within his rotator cuff. This type of tear is common in active individuals, especially those with repetitive overhead movements or gradual wear and tear over time. We sat down to discuss all of his treatment options, including their pros and cons. For partial tears like his, the first line of treatment is often non-surgical. Physical therapy, activity modifications, and pain management strategies are highly effective for many patients. However, because his symptoms had been going on for over 4 months and were severely impacting his quality of life, he wanted to pursue a more aggressive approach. We decided on a combination of platelet-rich plasma injection as well as physical therapy. PRP offered the potential to accelerate healing by delivering growth factors directly to the site of the tear, while physical therapy would focus on restoring his shoulder strength, mobility, and function. I explained that PRP was not only a treatment to reduce pain, but also a way to actively promote tendon healing, a key advantage over other options like corticosteroid injections. We performed the PRP injection in my office using ultrasound guidance to ensure precise delivery of the treatment to the site of the tear. He started physical therapy shortly after, committing to a structured program for 2 months. His therapy focused on gentle progressive strengthening exercises and movements to improve his range of motion, ensuring his shoulder healed correctly without stiffness or further injury. At his 2-month follow-up, his progress was remarkable. He reported significant improvements in both pain levels and function. Nighttime pain had completely resolved, allowing him to enjoy restful sleep once again. Repeat ultrasound imaging revealed early signs of healing, with new tissue visibly filling the damaged areas of his rotator cuff tear. By the 6-month mark, he was thrilled to share he had returned to an active lifestyle, hitting the gym, playing recreational sports, and most importantly, spending quality time with his kids without being held back by pain. The ultrasound findings were even more impressive at this stage, showing that his tear had nearly completely healed. This case highlights the power of combining advanced therapies like PRP with a dedicated physical therapy program. Not only did this patient avoid the risks and downtime associated with surgery, but he also achieved full recovery with a minimally invasive, evidence-based approach. Now, I know we covered a lot in this video, but there's a lot more to know about PRP, especially when it comes to avoiding common mistakes and understanding what to look for when considering it as an option. So check out this deep dive into PRP injections, where I'll cover everything you need to know, including the most common pitfalls and how to ensure you get the best possible results from your treatment. By the end, you'll have a clear understanding of how to navigate the PRP process and maximize its effectiveness for your shoulder recovery.